We never know the love of our parents for us until we have become parents. Our children's health and well-being are so dependent on our commitment to promoting food access and good eating habits at home, at school, and in the community. Taking care of our children's health is so important, and our job as parents is to reach to that goal and maintain for many years. Today, we meet our expert, Dr. Hani Haidar, to discuss our children medical cares. Today, on Time Waits for No One.
You have a baby. You no longer require sleep. You can eat and work with one hand. You are no longer afraid to look silly. You are no longer afraid to ask for help. You talk with your doctor about immunizations and get the facts. Welcome to parenthood.
Thanks for the invite, and thanks for the chance to talk about a very important issue, the health of our kids. A good society is a society that takes care of their kids, and hopefully we're going to help the people out there to know what to do with some of the important questions about the infancy, childhood, and hopefully the adolescence.
And that's really our mission in this program, is to educate the community. And now it's the turn for our kids. And the very common question, the people getting married, having kids, and now they have to take care of the kids and they are confused. They don't know. And that's why we are having you as an expert to guide us and tell us, as soon as that baby is born, what are the following medical steps which they have to take care of, starting when and what to do.
Right. Well, the first thing we usually advise people in our office is to actually come and meet your pediatrician. And I have to say that we have a great group of pediatricians here in Toledo. I mean, I would be very, very happy to take my children to any of them. Knowledge-wise, there's no question. I mean, we have a bright group of pediatricians. The most important thing is to meet your pediatrician ahead of time, to meet the whole group and see if you're comfortable with the art of medicine. Now, once that step is taken and you decide that, yes, we are going to come to see Dr. So-and-so, in the hospital, you tell the staff that your doctor is going to be that doctor, and most of the groups will, come and see you in the hospital. And we examine the babies in the hospital. We make sure that they're healthy. We make sure that they get a lot of knowledge about what to expect during the hospital stay, and more importantly, shortly thereafter, after they leave the hospital. So we talk about the nutritional part of it, breastfeeding, when to supplement, if it's okay to supplement or not. If the parents decide or the mom decide not to breastfeed, what the choices are available to us, there. Also to talk about what is normal in newborn, what's to expect. So for example, how many hours of crying would you expect with, the baby? A lot of questions. This comes like, my baby's crying, is that okay? When to worry about it, when to talk to your pediatrician, when to come and visit them. The jaundice, the GE reflux, a lot of those disorders that exist in the newborn period, we talk about with the parents. We tell them when to come for the follow-up visit as well. It is very important to remember that even from a cardiology point of view, there are murmurs that may not show up in the first 24 to 48 hours that are important to follow up at 5 days, 7 days, 8 days. These days in the hospital, we do a pulse oximetry, which is the oxygen level in the blood for every baby. We do a hearing test for every baby. So pediatrics is all about preventative care, and we talk about when to do those visits, when to call, and when to come extra in case you need to come extra. But generally, we see the babies in the newborn, nursery. When we discharge them, we see the babies again at 7 to 10 days, a little bit earlier or a little bit later based on each individual case.
The question really, which is we face these days always in the hospitals, most of these parents, they have a family physician, they have the people around them who recommend that doctor. It's not necessarily, they go and interview doctors. I mean, most of the time it's based on recommendation. They go and decide, let's say, Dr. So-and-so or Dr. Smith are going to be our doctors. I mean,
and that's absolutely okay. The community-based referral is the most common reason we get patients in our office, and that's great. But I would recommend for the new mother, especially the first-time mother, just come and meet the doctors. Just come to the office, sense what it is. You may not like it. I mean,
is it easy now? For that mom to call the office and say, okay, I don't have the baby yet, but I want to come and meet Dr. So-and-so. I mean, are they going to be welcomed, or they're going to be or told that you are crazy, you go and have your baby first and come back?
Yeah, we do welcome that. Actually, we encourage it as well. And during the time, we try to have the office manager does the walk and meet each doctor individually, because they may recommend, a cousin or a neighbor may recommend, Dr. Haidar, but then when they come and meet Dr. Jenny or Dr. Marianne or Dr. Jack, they may like him a little more than they like me, and that's okay. I mean, it's all about the choice of the parent and the comfort for the parent and the kid.
Sure. So if you go back into that, you mentioned in the first week or 10 days, you meet the patient and now the baby and their parents in your office, and I'm sure they will start asking all of these questions about, for example, that baby is a little bit yellowish jaundice. I mean, can you educate us a little bit about some of these typically seen in babies, but at the same time it's not necessarily a dangerous sign, although the mom and dad, they will panic and scared. Educate us about these colics, for example, symptoms and the abdominal pain, the crying, how long they can cry, and the jaundice. These are very typical things like what you said. Would you educate us about it?
Absolutely. I mean, I'll be happy to do that. For example, one of the board questions that I actually answered wrong one time is a normal newborn cries for, and the answers were 1 hour, 2 hour, 3 hours, and 4 hours. And it's like 4 hours, no way. I said, okay, fine, 2 hours. Well, the answer was 4 hours, okay? Wow. Yeah, babies normally cry for 4 hours. Now, after I thought about it, I thought, you're absolutely right. I mean, think about it. If you're hungry, you cry. If you have a little bit of gas, you cry. If you're changing the diaper, you cry. And so it is okay for babies to cry. They are not going to have a hernia if they cry, okay? Self-soothing. The faster we teach kids self-soothing, actually, the happier the kid is going to be, and the parents are going to be. Colic, we see a lot of colic. Usually it happens after the 3rd or the 4th week, and this is, a baby who cries uncontrollably for a couple of hours or 3 hours. Now, before or after, they're totally fine. They eat, they meet their weight gain, they poop, they urinate, they sleep, but then suddenly around 7 o'clock, 8 o'clock in the evening, and colic typically is going to be around 3 to 4 hours. There's mild colic, there's severe colic. God help people with severe colic babies. Sure. But, typically it is 2 to 3 hours, 4 hours of crying, uncontrollable crying. Now, afterwards, these babies are okay, all right? Now, the key point is these babies are eating okay. They're pooping okay, they're urinating okay. There is no blood in the stool, they're not throwing up. That's probably colic. Sure. What do we do about it? We give medications to the parents. I'm kidding. We educate the parents, okay? We tell them what, to expect with these kids and how to handle it.
If there's any medications for the colic?
Actually, we do some, herbal medication. Sure. Sometimes we do some gas drops sometimes. Okay. Sometimes they spit up a little bit, and sometimes they do not spit up. So the acid comes to the esophagus, and they arch and they cry and they scream, and it sometimes looks like colic as well. And it is important to recognize these kids, because there are some simple things we can do to help those kids. So for example, the way that these kids needs to stay, they always should like a little increase of the head over the body, because you know, gravity works for us.
Sure.
You know, increase that a little bit. Sometimes thickening the milk, if we can give,
Sure.
you know, through a bottle. It's if the mom is nursing, there's no luck with that, you know. But increasing the thickness by adding a little bit of rice sealer to the milk sometimes helps a little bit. And in some cases, we may end up needing some Zantac or some Prevacid, you know, for those kids. You know, when should you call the doctor if you have a crying baby?
Sure.
So I mentioned few of those things. So for example, if you have a baby who is less than 2 months of age, who has fever, there's no question the baby needs to be seen right away. It's very important, because fever in that age group could be the only cry for help that the baby can give you.
The only sign.
The only sign, okay? Another thing you need to be careful with is blood in the stool. So if you have a baby who's having, you know, blood in the stool, mucousy stool, that could be, you know, an indication of a disease. Also, if you have a baby who is throwing up a lot, not spitting up. Now, there's a difference between spitting up and throwing up. Throwing up is not normal. Spitting up is normal. If the baby is throwing up a lot and not keeping, you know, the weight, that's also something. Now, lethargy, another thing. You know, if the baby is crying a lot and then it's hard to wake up, you know, lack of interest in food, you know, that's another baby who needs to be seen as well. But like I said, if you have a baby who looks like a rose, you know, happy, good tone, not lethargic, eating well, pooping okay, and crying, that's a different story.
What about the jaundice?
Jaundice is very, very, very important, okay? We actually check bilirubin for every baby before they go out of the hospital, okay? Jaundice, there's what we call physiologic jaundice, or breastfeeding jaundice, or like I like to call it, the lack of breastfeeding jaundice. In the first 3 to 4 days when the mothers are breastfeeding, okay, there is not a lot of milk. So there is a little bit of recirculation of that, you know, bilirubin. There's no flushing to the system, if you will. So as of natural, you know, response, the body would have an increased bilirubin. They usually peak around 5 days of age. So before we discharge the babies, depends on the age of the baby and the elevation of the jaundice, we can kind of predict, okay, whether this baby is going to require a close follow-up, phototherapy in the hospital or phototherapy at home. And it's very critical to remember that babies who are breastfed tend to have their jaundice for a little longer time. And that's a normal thing, and we encounter this question all the time. When you have a baby who's eating, who's urinating, who's stooling, who's, you know, aggressive, meeting the expectation with the weight gain, and the baby is still, say, jaundiced by day number 8 or 9 or 10. Well, we expect that. We expect that, and we tell the parents to watch for those signs that will be red flags, as we talked about. But we expect that jaundice to be there for 3 to 4 weeks in some instances if there is a breastfed baby.
So basically what you are suggesting that not necessarily any of these signs is a dangerous sign and the family has to be so concerned. I mean, the only thing which you are suggesting is to call your pediatrician, discuss it with them, or go and see them actually will be better. Follow up on the matter. It's more educational, and then they will be determined basically if it's a serious issue, need to be monitored carefully or not. Great. And going to the feeding now, which is, you mentioned breastfeeding versus, you know, no breastfeeding. Can you give us your educational or your knowledge about which one is better, and also at the same time educate us about how the moms should feed their kids appropriately?
I can tell you I'm a pediatrician. You're not going to find one pediatrician who's going to argue about whether breastfeeding is better or not. So there's no question. Breastfeeding is, I call it liquid gold, okay? It's sterile. Well, I'm not sure about sterile, but it's clean. You know, it is very healthy. It is free. It is available to you. It promotes health, no question about that, promotes nutrition, and promotes the bonding between the mother and the child. When and if possible, I think breastfeeding is better for your child for the first year of life. There is no question. Having said that,
year.
Sure. Absolutely.
If you
You
can.
know, now, I do not believe in only breastfeeding for a full year.
Okay.
Okay. I'm not against it, but I definitely introduce food around 6 months of age. Okay.
Okay.
But if you can, breastfeeding is definitely better for your baby.
Okay.
It's more bioavailable. It's a little healthier for your baby. Now, most of the commercially available formulas are going to be thriving as hard as they can to come close to breast milk.
Part-time breastfeeding is not wrong. I mean, for the mom to go to work and she can breastfeed her kids or her baby in the morning, and when she come back in the evening, it's not something wrong. I mean, it's actually advisable, better than nothing.
Absolutely. Any breast milk is better than no.
So, you know, the pumping concept also is ideal, I mean, in that case.
Absolutely. And again, it's very important to remember that what we advise here may not work for every single individual. There are cases where the pumping is going to not be very good for the baby because there's not a whole lot of breast milk.
Okay.
The way I look at it, once you put the baby on the breast and the baby is done eating, I think pumping is not a bad idea at that time because if you remember, there is going to be a cycle.
Sure.
Okay. Now, if we empty the reservoir, the brain is going to get a message saying, okay, the reservoir is empty. So it's as simple as the brain is going to send a message to the breast making, okay, we'll make more, okay? Now, if we don't empty the reservoir, there's going to be a negative feedback cycle saying, okay, they're not using it as much. So a lot of times we give the kid what the baby needs. I mean, the baby needs to take what the baby needs to take, and then the extra we can pump and we can freeze. And depends on the freezer, we can freeze it for 90 days up to 120 days. And we can use it. Now, once we bring it down from the freezer, we cannot refreeze it again.
Okay.
But we can definitely thaw it and use it.
When we come back, we are going to talk about some more subject related to vaccination, which is a very big debate about that issue when it comes to our kids' care. Why immunize our children? Sometimes we are confused by the messages in the media. It's true, some diseases like polio and diphtheria are becoming very rare in the United States, of course. They are becoming rare largely because we have been vaccinating against them. Unless we can stop the leak, eliminating the disease, it's important to keep immunizing our children. The bottom line, we vaccinate to protect our children, our future, our lives.
Is your heart clock ticking? It's time to change your future with Toledo Cardiology Consultants.
A lot of people choose salad for a low-calorie, low-fat meal. This salad is 450 calories, and the dressing can add up to 100 calories. A grilled 7-ounce chicken sandwich has 350 calories. You could add a kid-sized fry and still have less calories and fat than that salad. Choose wisely, because I don't want you to end up here. Remember, time waits for no one. Welcome back. It's my pleasure again to welcome Dr. Hani Haidar, and we are talking about pediatrics care, about kids, our babies, and the biggest debates which we hear a lot lately about should we or we should not vaccinate our babies. And that's a big question, and I'm glad Dr. Haidar is going to give us the highlight and his informative knowledge about this subject in specific. Hani, what do you think about vaccination?
Ameer, again, you're asking a pediatrician. I am definitely an advocate of vaccinations. Vaccinations, there is no question, they do save kids' lives. They do reduce the morbidity of kids as well, the disease status for kids. When people ask me, what is the value of what you do as a pediatrician? If you want to put numbers on what the value of what you do, there's no question. Without thinking, I'd say I make sure that most of my patients are immunized. Okay. Number 2 is I listen to my patients. Number 3, hopefully I educate them. So vaccination is definitely high on my list. And the big question is whether vaccinations cause autism or increase the chance of autism or autistic spectrum disorder in the United States. And because of that, I have a lot of patients lately who who actually, question whether they should vaccinate their kids or not, and they have a predetermined, schedule, if you will, on vaccinating their kids, and I approach it the same way we approach breastfeeding. Okay, sure. If I go comfortably with them on the schedule, most of the time we actually immunize these kids fully. Mm-hmm. We may immunize them a little late. Okay, we may immunize them in a different schedule. I have a family who come every week, get one vaccination at a time. It is very important to note that most of the vaccinations that are used in the United States are mercury-free as well. Mm-hmm. A lot of them are preservative-free. Sure. And a lot of the groups that are worried about the autism were worried about whether, it is okay to utilize or use preservative with our, vaccinations. And now most of the vaccinations are preservative-free. The other issue is the MMR, measles, mm-hmm. mumps, and rubella, and the connection between the measles, mumps, and rubella to the, autism. To date, I am yet, and I always tell my patients, I'm a practitioner, I'm not a scientist, so I do not conduct studies, mm-hmm. I report studies, and sure. there has not been studies to link autism to measles, mumps, and rubella. There are some European countries, there were some European countries who tried actually to not vaccinate their kids mm-hmm. because of side effects to the vaccination. If I remember right, England stopped mm-hmm. the pertussis tetanus mm-hmm. Vaccination. I think in Japan they stopped it as well. And they also stopped the MMR for a period of time. And what happened is the return of the disease was overwhelming. Mm-hmm. There were cases of pertussis and cases of measles that were not seen when given the vaccination.
And actually in Japan, to my understanding, if I'm not wrong, after they stopped those vaccination, the increase in the number of cases of the disease was almost 5 times of the one before the vaccination, right. Which is bring us really to the most important point that we are in the United States. If we are able to eliminate most of these diseases, it's because of the vaccination. We don't hear that many of right. patients who are having right. those problems. It's because really the pediatric community did a good job right. in doing the vaccination. And definitely we have enough monitoring system from the FDA to the American College of Pediatric to the CDC, which is all of them agree about the importance of vaccination, and that's why the family and the moms, dads should understand how important, if you want your kids to be healthy, you will not forgive yourself if that one kid is the one who developed that disease just because you did not give the vaccination. And we have to believe the experts who are talking to us and telling us all of that information.
We become numb mm-hmm. to those diseases because we don't see them anymore.
That's exactly right.
I grew up in Syria mm-hmm. and I have 2 doctors, friends, who had polio. Mm-hmm. Now those 2 kids did not have the same opportunity that I had in playing soccer. And in Syria we breathe soccer. Yes. And playing soccer was a big thing for my life. And guess what? If I had polio like my 2 friends had, I was not able to play soccer. Now those are the people who were lucky enough to not die. Okay, so we become numb because we don't see those diseases. We don't see measles anymore. Mm-hmm. Okay, actually, it's funny, we don't see chickenpox anymore. I mean, at the 20 years down the road, I'm gonna have tough time diagnosing chickenpox, which is again thanks to the vaccination.
So based on that scheduled immunization, when do we start? And I understand, and correct me if I'm wrong, it's about 14 immunization right now, or vaccination we are using,
I think it's
more than that?
I think it's probably more. Now
So
I lost count.
I'm behind.
I lost count at 14, But we do start the vaccinations, the regular schedule. Like I said, you don't have to stick 100% to that regular schedule, but the regular schedule, we start at the hospital. We give hepatitis B in the hospital. Mm-hmm. We repeat it again at 1 month. When the babies come to our office, they come at 1 month, 1 week, 1 month, 2 months, 4 months, 6 months, 9 months, 12 months, 15 months, 18 months, and 2 years. And then after that, it's an annual visit. Sure. And the bulk of those vaccinations are going to happen in the first 2 years of life. Mm-hmm. Now, at 3 and 4 years, except the flu vaccination, there's no vaccination. And then we do, again, shots at 5 years of age before school entry. And after that, we have no vaccinations until 7th grade, you know, 11 to 12 years of age. So even though they sound that there's a lot of them, okay, there's no question they do protect against a lot of nasty diseases. They promote health, and they're not a lot once you do most of them. You know?
Absolutely. Does the parents has to keep a record of that? I mean, I remember that when my son went to college, somehow they requested for some information about vaccination,
Absolutely.
and I couldn't really obtain it that easy. I mean, I didn't pay attention. Can you educate us about that? Do you give a copy to the parents to keep it in their record, or you keep it only in your office?
Yeah, we keep it in our office, but I have to give this to my partner, Dr. McBride, who came up with this absolutely smart idea. He asked all his patients to take a picture with their iPhone or any smartphone, and email it to themselves of the vaccination. So as they leave, we give them a vaccination record, and he says, I'll tell you what, either scan it or put it in your phone. And it's just, I tell you, it is wonderful to have that.
Going to those vaccinations, the biggest question always the parents has, are there any side effect from some of the vaccination other than the possibilities? I'm talking about the real side effect when they get the shots. What do they expect with their kids?
You know, I label, you know, and again, this is not scientific. This is based on experience. I always tell my patients, if you take 10 patients, you got 7 out of 10, these kids would not feel anything. Okay, so when the parents come at the 4 months visit, I ask them how did he do or how did she do at the 2 months visit. Most of the time, the parents look at each other and say, we don't remember, which means that there are not a lot of side effects.
They did well. So what is the low grade fever we are talking about when we are talking about vaccination? You know, like what you said. I mean, that fever, it's defined between 100 and 103. I mean.
Sure. I mean, you know, a lot of parents, you know, report 99.3 or 99.5. Well, that's, I'm not too worried about that. You know, the way we look at it in our office, we say anything above 100.5, you probably shouldn't, you know, tell us in the first couple of months of life. And then if you had a temperature, if the baby's doing okay, and you have the temperature of, you know, slightly above that, that's okay. We can wait until the morning, and we probably should see the kid.
But it's still better to report it to the pediatrician.
Absolutely, it's not a bad idea to report the side effects, you know, of the vaccinations, just so we would also expect in the future, you know, what doses of medication, you know, to give. The Tylenol, for example, what's the dose? Because with pediatrics, it's based on, you know, milligram per kilogram, and a 2 months dose is going to be different based on the weight of the baby.
Absolutely.